this is Lauren Syed. I'm a physical therapist assistant with Young's Physical Therapy and Sports Performance in Greenville, North Carolina, and a comprehensively trained Pilates instructor through Body Arts and Science International. And Lily is here in the background as my co-producer, Lily Syed. Today I wanted to do a few little exercise or tips to keep some of you mommies to be just active and moving and feeling well. So a few things, prenatal exercises that are safe and that maybe should just be done on a daily basis are pretty much what I'm doing right now, sitting cross-legged. So sitting cross-legged is a great way to keep the hips open, especially as you get a little further along and in preparation for delivery. So sitting cross-legged, you're going to want to try it both directions and just getting comfortable in this position. Another position that's great is going to be a good butterfly stretch, or a bound angle position is what we call it from yoga. So my feet together, I'm going to try to pull my heels pretty close to my groin, and I'm going to let my knees open. You could even flutter a little bit like a butterfly, and again, a nice hip opening position. Lots of good breathing. I didn't note that, but this is a great position, or that cross-legged position is a great place to practice some breath work, which we'll make sure that we practice a little breath work in one of our other positions. So, next one, hands and knees. Great position for mommies to be. So hands under shoulders, knees under hips. This position, we're gonna do a good old kind of cat, dog, or wave stretch. I want you to really focus on the movement of the pelvis. So pelvis rolls under, spine rounds, pelvis, tail really tips up towards the ceiling, and the spine shoots off from the pelvis. So we're rounding, and then what we might call an arch or an extension. I'm gonna breathe out as I roll my pelvis under. I'm gonna breathe in as I tip my tail up towards the ceiling, and again, my spine just shoots off from the pelvis. So great position to be in. Now, that can take you into a child's pose, so I'm gonna bring my big toes together and let my knees open wide. Depending on belly, and you will need to maybe just adjust your legs a little bit, open or close to your comfort level. And then I'm gonna just come down on my forearms. So again, with a pregnant belly, you may have to make adjustments, and you could be on the forearms, or you could fully extend the arms and let the chest rest down to the earth or to the floor. That child's pose position, or this position where the hips are set back, really helps to open up the pelvis and the pelvic floor. So a great position to stretch in, to just kind of lean and get a little relief from the back end. All right, so that position, another great position for our mommies to be, to help again open up the pelvis. Even a nice laboring position would be a good lunge stretch. So I've got one foot forward, one leg back. I want to try to level up my pelvis, but I'm going into a lunge stretch, and I can even kind of rock that forward and back a little bit. Hello. So of course you're going to want to do this on both sides. So again, just to make sure that I note that the hands and knees position, this lunging position, the child's pose position we did are all great positions in those stages of labor where you're doing some pain relief and just still trying to keep moving and help to work baby in the right direction. So last but not least today, I want to go over a position of just comfort, and this is most likely a position you're finding yourself in sleeping. Of course, sleeping, you're going to want a pillow, but you can just rest your head on the arm. I'm going to take my top leg, and I'm just going to let it spill in front of me to help, again, kind of open up the pelvis a little bit. So this is a great position to do a little bit of breath work, even a little bit of, if you're doing kind of some meditations, some visualizations, or some relaxation techniques.
But the breathing technique that we're going to do today is going to be in on a count of 4 and out on a count of 6 to 8. So we'll start with a count of 6. So we'll take a breath in through the nose for 1, 2, 3, 4. You're going to breathe out for a count of 6. Out, 2, 3, 4, 5, 6. We'll breathe in for a count of 4. Out for a count of 6. I'm breathing in through my nose and out through my mouth. If you prefer out through the nose, that's totally fine. I just find kind of out through the mouth is kind of a nice kind of release for me, and definitely was during labor and delivery. So let's do 2 more breaths like that, but we're going to try to go up to an 8 count on the exhale. So we're going to breathe in for 4. 1, 2, 3, 4. Breathe out for 8. 1, 2, 3, 4, 5, 6, 7, 8. I'm going to do that one more time with you. Inhale and exhale. I hope this is something to keep you moving. If you can, get outside and walk. Once again, keep yourself safe and well. Thank you.